When we were looking at the muscles, a quick and easy way to learn their structure is to identify the origin and insertion by using the action. In this example, we have the bicep that contracts, which flexes the arm or brings the forearm closer to the torso, which is called flexing. We can see the origin and insertion marked for us. The origin is more proximal to the torso or proximal to the body, and typically the insertion is distal to the body. You can also use these to show the non-moving versus moving part. The origin is always going to be stationary. So when you flex the arm, the forearm is the moving part, and you can see the insertion on the forearm, specifically the radius. The origin is the non-moving part on the scapula and the humerus. Now we can look at a few examples here to help reinforce that. Once again, on the left we see the origin and insertion of our biceps, which is used to flex the arm. But here we can see the triceps on the posterior of the arm that would be used to extend the forearm. And again, if we, starting the flex position, extend the forearm is the moving part. The insertion would be on the ulna at the elbow, and then the origin is on the scapula and humerus. Looking at the lower leg, we see the gastrocnemius, which has its origin on the femur, and insertion on the calcaneus, which is the bone of the heel. When this muscle contracts, the muscle will pull towards the origin, so as it pulls on the heel bone, you will point your toes at the floor or the ground, which is called plantar flexion. So this is the action of the gastrocnemius, plantar flexion, because it is pulling on the calcaneus, that heel bone, and how the lever action works with the ankle. It is contracting towards the origin, which is not moving, while the heel bone is the moving insertion point. So just be aware when you're studying and learning muscles to identify the origins and insertion, which will be basically the structures that we've learned on the bones. So that will help you use those terms again for the origin and insertion of the muscles.